Hello, I'm Dr. John Bashai, Associate Editor of AFibProfessional.org, an HRS ACC clinical community on cardiosource. I'm here with Dr. Luigi DiBiase to discuss the results of the COMPARE Randomized trial. Dr. DiBiase is from St. David's Medical Center at Texas Cardiac Arrhythmia Institute in Austin, Texas, as well as Albert Einstein College of Medicine in New York. Welcome.
Thank you very much.
So tell us a little bit about the trial and the results.
Yes, the COMPARE trial, which I had the pleasure to present on behalf of co-authors and the principal investigator, which is Dr. Andrea Natale, is the first randomized study that look at periprocedural stroke. And we look at periprocedural stroke while randomizing two different anticoagulation management for the atrial fibrillation ablation procedures. We compare off Coumadin, so the old style, which includes the discontinuation of warfarin before procedures with the bridge with the low-weight molecular heparin, versus atrial fibrillation ablation procedure performed without Coumadin discontinuation, and we look at periprocedural TIA stroke as well, bleeding complications. We look at that at patients with high risk, so especially patients with non-paroxysmal atrial fibrillation and patients with a high CHART score. The interesting results is that there was a statistical significance difference in terms of periprocedural TIA stroke, because when procedure was performed without Coumadin discontinuation under a therapeutic INR, the number of patients that experienced a TIA stroke was dramatically different, 2 patients versus 39 patients.
Excellent. So can you maybe tell us a little bit about the implications of this clinical trial as we move forward in the ablation of patients with atrial fibrillation and anticoagulation issues?
Well, everybody of us knows that there is a strong correlation between atrial fibrillation and stroke. And one of the major reasons of performing ablation is to give to patients sinus rhythm to reduce the risk of stroke. So iatrogenic stroke, the one that happened during an ablation procedures, is the worst complication that may happen for an electrophysiologist. So any technique and any management that can reduce this risk is of course welcome in our field. And this possibility of performing the procedures without Coumadin discontinuation and having a dramatically less number of TIA stroke, it's an outstanding results of the trial.
And can you comment maybe on moving forward with the newer oral anticoagulants as we start to explore, the efficacy and outcomes with those drugs? Where do you see that fitting into this trial?
Of course, we have explored the two currently available strategies, which is the warfarin with bridge versus the warfarin without any discontinuation. Warfarin is a drug that we have been using for the last 50 years that we know well. And so these are the two strategies that we compared. Now we have new oral anticoagulants that are an exciting change for patients having atrial fibrillation. I think the results of the trial will guide further studies that will have to compare newer anticoagulants with the procedures performed without warfarin discontinuations, rather than comparing strategies with discontinuation and bridge with Lovenos, because we know that the procedures is less riskful if performed without Coumadin discontinuation in high-risk patients. So I believe that the newer anticoagulants should look at comparison with this strategy rather than the other.
Sounds great. Well, on behalf of AFibProfessionals.org, we'd like to thank you for joining us today, and congratulations on your trial.
Thank you very much for the opportunity.
Thank you.